Hi, I wanted to make a quick video about a summary of the occupation of a dental hygienist. This is very informal and by no means probably not as in depth as what I would like to do, but I wanted to have something for the students who don't know much about what a hygienist does in occupation. So, a dental hygienist is a licensed preventative oral health specialist, and oftentimes dental hygienists will work alongside of a dentist, but they can also have their own, but they do have their own schedule of patients for the day. So sometimes people get dental hygienists and dental assistants mixed up. Dental assistants work with the dentist. They assist the dentist, but a dental hygienist has their own slate of patients that they work with throughout the whole day. So they work independently in their own room with their own patients. Dental hygienists can work independently of a dentist also with different rules and regulations for different states. So when we think about the scope of practice for a dental hygienist, it really does vary quite a bit. We are very lucky in Oregon. It's a very progressive state. So dental hygienists in Oregon can have a lot of autonomy. We can have what's called an expanded practice permit, where we either, with the collaboration of a dentist, if we want to do a few extra things, or even without the collaboration of a dentist, we can set up our own sort of brick and mortar, or we can go out into the public and treat patients at nursing homes, in anybody who's under the poverty line, a certain percentage of the poverty line, we can see them, children. So dental hygienists can actually own their own business and run their own business, even without working alongside or under a dentist. For skills and expertise, a very generalized overview is everyone kind of just thinks of, I'm going to get my teeth cleaned. My dental hygienist is going to clean my teeth. We have different types of cleanings. The prophylaxis is sort of our general cleaning that we will do if somebody is generally healthy, most of the time children, healthy adults. But then there is a whole world of periodontal therapy, and this is focused on people who have disease in and around their gums. And it's much different from a regular cleaning, and I won't go into all of that detail, but just know there's different kinds of cleanings that dental hygienists do. We also do a lot of preventative care. Two examples there is fluoride and sealants. There are other things that we use in the office. There are lasers. Dental hygienists can use lasers to disrupt biofilm and kill bacteria. They can also use different equipments called air powder polishers. It's a different way of cleaning up the bacteria below the gum line or removing stain. And all of these are sort of in the categories of the cleaning and preventative care. We do a lot of oral health education. We're always talking to our patients about ways to keep their mouth healthy, but also in extension of that to also how to keep their overall body healthy, because the mouth is not separate from the body, and all of the blood that flows through your whole body, if you have heavy bacteria in your mouth, that's going to carry the bacteria through your whole bloodstream and affect the whole body. So the mouth is not separate. So we do a lot of oral health education, but we also do a lot of overall healthy living to keep your whole body healthy. We screen for oral diseases such as periodontal disease, decay, oral lesions that we see that are not viral, different viral things that are in the mouth, or maybe just trauma. So just that we screen for all that stuff. Oral cancers, we screen for that. We expose radiographs, which you might think of or just hear of as dental x-rays, to look at bone levels, to look for caries or a cavity, a dental cavity or a decay. We also do a whole slew of assessments of our patients' oral health. We do that through, one way is periodontal probing and just assessing the amount of plaque, bacteria, the way the tissues look, how much bone loss there is, how much tissue is attached, and if it's healthy or not. If there's a lot of bleeding. We do all kinds of assessments of the oral cavity. We learn a lot in school. A lot of people don't realize how much we have to learn in school. We are sort of l- we like to think of ourselves as head and neck experts. We know a lot about head and neck anatomy. We give local anesthetic, and so because we give these injections, we have to know a lot about pharmacology. We have to know how medications react in the body, and we have to know head and neck anatomy, so we know where we're putting that needle. We place restorations after the dentist has prepped a tooth. We can place an amalgam silver filling or a white composite restoration. We place other medicaments like antibiotics and silver diamine fluoride. And then we focus a lot on systemic diseases. Like I already said, because there's a major connection between oral health and systemic health. So we focus especially on things like diabetes and heart disease. For the education, someone who's interested in dental hygiene, they have to go through all the prerequisites that basically like a nurse has to go through, microbiology, anatomy, physiology, chemistry, all of these courses. And then they get into the 2 years of dental hygiene. Now, if they're at a community college, they might do all of that in 2 years, but it's a lot. It's a heavy, heavy load, similar to like a 2 year nursing degree. Or they may take all their prereqs and then just do their dental hygiene courses. And they would get an associate. That's the minimum you can have to get licensed and see patients. Here at Pacific, we offer a bachelor degree, and so there's added courses to add up to make it worth a bachelor's. It's the same amount of patient care experience, but we add courses in public health, in research, in education. So there's a whole different grouping of courses in order to, when you graduate, you have a bachelor's. And then there is even a master's in dental hygiene, and that focuses more to prepare people to teach, to be faculty members, to work in public health, or to lead out, maybe be the director of a program, or work in some, public health through, a federal program or a state public health program, or, some other. There's all sorts of places that hygienists can work. They can also work in corporate for dental companies that make dental products. There's all kinds of different things that if you have your master's, you would be set up in order to for that type of career. So that's sort of an outline of the education. So the best things about it, we get to work with the public. We help to maintain good health. We make connections with our patients. Our patients usually end up really loving us. We see them oftentimes more than they see their doctor or the dentist. So we get to know our patients. We form connections and relationships with them. We work with other professionals too, although not as much as in the medical field. Sometimes as a dental hygienist, you can feel a little siloed, but if you work as an independent dental hygienist or in a specialty practice, you might get more exposure to other health professionals. And we are teaching our hygienists to reach out to other health professionals too, to see where we can make those connections. There's lots of education. When you're an RDH or a registered dental hygienist, you spend a lot of time teaching your patients. So you gotta love to learn and love to teach. And that's just a little overview of what it's like being a dental hygienist. Thank you very much for listening.